Talent doesn't work, sir. Hard work is must. As you regularly say in your videos, luck favors those who work hard, and most of the time it comes true. But our part should be 100%. Sir. We should give our 100% in our work and hard work. We should make notes. We should revise, and whether it is in SS or NEET SS, we should try to crack every exam. And one thing is hard work beats talent when talent does not work hard. I was just reading and I don't know where to focus and where to stress. Then from one of my seniors, I got to know about fine neurophilia videos on YouTube. I realized that if I had seen these videos earlier, I would have cracked AIMS April. Then I thought that, okay, now what has been happened. Now let us complete all the videos of fine neurophilia. And I used to make a notes and I used to take screenshot of everything which you have shared on the YouTube, sir. And whenever an exam comes, I used to first go through all the topics. My first MCQs are with free mock tests in the group you have. You used to keep free mock tests. I used to write that free mock test. After that, you started tackles. Yeah. Then I went into tackle and I subscribed to tackle. Then I used to do questions regularly. Sir. You were uploading a weekly test of tackle. Then I used to see and I used to analyze my rank. I divide the knowledge of each specialty into fact-based and concept-based.
So, good morning, everyone. Welcome to yet another episode of DM Neurology Made Easy. I'm Dr. Ahamed Subir, Assistant Professor in Neurology at MES Medical College, Perindalmanna. So, this is the face-to-face with toppers session, and we have reached the year 2022. And I had started all this coaching programs from 2019. And I'm happy that I'm able to interview people from the group who have reached the top positions both in NEET as well as in what you call the super specialty exams. And it's my privilege actually to now introduce to you Dr. Naresh Babu, who has got the first rank in NEET SS Neurology. And I'm really proud because apart from him and his family, maybe I would be the most proud person because he's very passionate about neurology, and he wanted to be in a particular institute, and he had sacrificed lots of things to get into that institute, and that is one another quality which a person should have, and that I appreciate him for that quality apart from whatever achievements he have got.
And also, he told that he has been following me only for his entire learning period.
So, with that, I'll introduce Naresh. Congratulations, Naresh. Yeah, this platform of face-to-face with toppers is intended to tell your juniors who are planning to prepare for the next year how to go about with this NEET SS training, because you know the drastic changes happening, the very sad situation of Corona.
Very good morning, sir. I'm happy to meet you on this interview. Actually, I did my MBBS from Osmania Medical College, sir, from 2012 to 2018. Then I got into NEET PG, sir, and I did my MD from Nizam Institute of Medical Sciences, Hyderabad, from 2018 to 2021. Then I joined as a research sir. Actually, I was very fond of medicine, sir, MD medicine. That was my real goal. I want to be a good physician. Then neurology was my favorite, sir, since my MBBS. I was thinking of becoming a neurologist. When I was in MD General Medicine, I used to read medicine, sir. But in the last year, February and January, at that point, I decided I should take a step and I should go for reading for neurology. And I started preparing for neurology from last year, February. And the first exam which I wrote was AIMS, which was in April, before my MD final exams. And at that time, I could not crack it, sir. I was not qualified in that. Then I thought that maybe I am not in the right path. Maybe I am not aware of where to focus. And at the time also, I don't know about your fine neurophilia videos. I was just reading and I don't know where to focus and where to stress. Then from one of my seniors, around after completing my MD exams, when I joined SRC, I got to know about these videos, fine neurophilia videos on YouTube. Then I had a look on those videos. And when I saw the videos, I realized that If I had seen these videos earlier, I would have cracked AIMS April, say first session. Then I thought that okay, now what has happened has been happened. Now let us complete all the videos of fine neurophilia. Then I started reading fine neurophilia videos in each topic wise, and I used to make a notes and I used to take screenshot of everything which you have shared on the YouTube sir. And whenever an exam comes, I used to first go through all the topics like spinocerebellar ataxias and Parkinson's tables from Bradley. Don't know where to concentrate, and after seeing your videos, I got some direction towards my goal, and I was going in that pathway, and that's what fetched me the results. Actually, I am from general medicine, sir. So pediatric neurology, I was not reading much of because Harrison has less of pediatric neurology. So I found it somewhat difficult. But when I saw the videos of Dr. Kunju, sir, there were 3 lectures on fine neurophilia, the 4.5 hours, and that I saw those videos at least 3 times. Sir, each video I saw 3 times, and I made a notes of like leukodystrophies we don't have in Harrison, and I came to know leukodystrophies. I learned leukodystrophies from SARS lectures, and I have watched each video 2 to 3 times, and I made notes and I regularly revised before going to any exam. And Sudip Kotaresa's video on vertigo, that was what dizziness demystified videos, and those were very helpful, sir. Actually, it was a difficult topic for me. I was facing difficulty in understanding those videos. But after seeing the sir videos, I had a good overall basic concept that I was able to make a differential diagnosis. I was come to differentiate vestibular migraine from DPPV or stroke, and those points helped me a lot, so in understand the difficult. And neuro videos of Sudip Kothare sir also helped me a lot, sir, regarding the cranial paralysis, and those are very helpful, sir. And thanks to Dr. Kunju sir and Dr. Sudip Kothare sir.
I wanted to know, like, which all books did you study? Like, which all books should would you say that they should study regarding? Is it Harrison alone, Bradley? That is a usual question that would be coming. Maybe the next year's pattern would be changing. What is your opinion regarding that? Books to study in NEET SS Neurology.
Neat as neurology, Harrison is the base, sir. On that platform only we need to build. And Harrison, after seeing some of the videos of fine neurophilia, I came to know that these are the places where I need to concentrate. Okay. Like some tables of Parkinson's and genetics.
Yeah.
And there was question also on that in the last month NEET exam. Those tables, first Harrison need to be concentrated, sir, and we need to focus. We need a guidance like fine neurophilia, and on that videos, I got a basic knowledge of Harrison and where to concentrate. After that, then as you also showed the Bradley videos and some topics of Bradley, especially seizures and muscular dystrophies. Yeah. These are not well covered in Harrison, and so I read them seizures and dystrophies from entire Bradley's. Oh. And then I made a notes of it. Okay. Like some EEG important points, and dystrophies also were very difficult. So I used to make a notes of it. And whenever an exam comes, I used to revise from that one. And I did not open the Bradley. I just read the top topics. And Parkinson's also, sir, the one very important topic. And multiple sclerosis and cerebrovascular accidents. These topics and channelopathies. These topics I made a notes from Bradley's. Okay. And I used to revise them, and seeing your videos, and I used to add any other new points in that from the textbooks, and that's what the way I went in this direction.
Any other MCQ book you referred?
So actually, my first MCQs are with free mock tests in the by conducted by you, sir. The group you used to keep free mock tests.
Yeah.
I used to write that free mock test. Okay. In that free mock test only, I realized, okay, still I need to improve. I am not up to the mark. I am not focusing on the questions which are asked. And that gave me the direction. And after that, you started Tackle. Yeah. Then I went into Tackle and I subscribed to Tackle. Then I used to do questions regularly, sir. You were uploading a weekly test of Tackle. Then I used to see and I used to analyze my rank. Okay, I need to improve. I used to make a lot of mistakes in Tackle. But I used to revise them regularly, and I did not repeat any mistakes again. That's what means, sir, with the videos and with Harrison, Bradley, and MCQs are also mandatory.
Okay.
And with these MCQs, I used to improve. I made many mistakes. I should not repeat them, and I should improvise. This was my strategies.
So according to you, the two books, uh, five neurophilia videos, I have also heard that it's not just because I am doing it. I have also heard that they were very useful for all the those who have written neurology this time. Definitely, Tackle was actually a platform which could be useful for both for me and for you, because daily putting free mock test in my group, I was unable to put a proper rank, and I was unable to convey to you all people, because this with Tackle na, every time the schedule could be correctly done of all these mock tests, and number of questions given in Tackle was actually enormous, and it's not all questions actually. Lots of new questions I tried to put in between, relevant and probable questions that would be asked in Neet. And when I looked into the recall, really, I came to know that some questions I have specifically noted and told that. I remember one question on MPS, or mucopolysaccharides. So that question, I maybe gut feeling or something that came. So that kind of matter, when we can convey that for that we need Tackle or some kind of app, and that should be a startup, so that it won't be cutthroat, or it won't be trouble for all the learners. So that is the why otherwise I would have done it in that Telegram group itself in the free form. Okay, so that is regarding your knowledge. So when did you actually start it? You are saying that in the SRship you had started your learning, or do you think that it should be this learning for Neet should be started, because now IIT coaching starts at third standard, fourth standard. No, that kind of attitude is there. So should the Neet SS learning start at, I'm not telling MBBS level, at least MD first year? That kind of attitude should the people keep in mind. First year they should start secondary. Did you feel like that, or they should wait till they finish their MD and start it at the SRship when they start their SRship?
Actually, sir, most people won't be thinking of super specialty on the first year of their MD. When they go to peripherals, their mind gets diverted to somewhat different specialty. I should do this specialty, and for some they might be prefixed from the MBBS itself. Like I am. I am prefixed to be a neurologist from MBBS onwards. So if they are prefixed, they should start reading from. And anyhow, this year Neet pattern is going to change in June, and they are going to ask questions from each and every specialty. So now they should start reading from the first year onwards. They should be good thorough with the core concepts in each specialty, endocrinology, whether it is cardiology, nephrology, or neurology. They should be thorough with rheumatology also. They should be thorough in the core concepts of each and every specialty, and that's what will make them fetch a good marks.
Next time it is expected to be different. The Neet SS pattern is going to change. So everyone is worried, and I am expecting that this time most of the people would be, whatever rank they have got, they will be trying to join in some institute, because the next pattern is going to be kind of a broad specialty pattern, like medicine pattern. So now this pattern was favoring those like repeaters, or those who are focused on neurology, or more passionate about neurology. So what do you think would be the next pattern like? It will be like a broad specialty pattern, whether it would be favoring repeaters or freshers, or what do you think? And how should they go about studying for the next Neet SS pattern?
Sir, first of all, now there are two. Now the other people are divided two categories: those who are coming freshers, and those who could not crack NEET SS, and those who are waiting for again writing the exam. And for those who have completed their MD, and 1 year might have elapsed, and for them it will be somewhat difficult, sir, but not impossible. I think they should start reading from today itself, sir, because since these days they might be focusing on the core specialty part only. Like neurology people might be focusing only on neurology. But now they should move ahead and they should start focusing on the remaining specialties also. They should start reading and they should make a notes and core concepts of each super specialty they should have on their hands, preferably by making notes and regularly revising that. And so further, my opinion on them is they should start reading from the day itself, because there is only 4 months of duration for the upcoming NEET SS exam, and time is very less, and Harrison is vast, and you should start revising from today itself. And for those who are going to complete MD or those who are already in MD, and they should start reading from the first year only itself. Means they should have a good grip on what they are doing and what they are practicing. Um, though they might be prefixed that they want to do neurology or endocrinology, they have no other option. They should start. They should be a good physician first. Then only they should become a thinking of. They should think of becoming a good super specialist. And first they need to give their 100% in the NEET exam. And after coming the result, their specialty, their choice may depend on what they want to become. But they should read from the day from the MD course itself. They should start reading. They should have a good foundation for their good physician. Even though if they super specialty if they didn't get, they should be first a good physician, then a good super specialist.
Okay. So from what you are saying, I understand that those who are in MD first year and second year should aim to be a good physician first, or pediatrician should be trying to get try to be a good pediatrician, because pediatrics would be a different broad specialty for that kind of subjects. Then for physicians it would be a different one. And once they finish, maybe during the SRship or in between time, they can kind of focus on their passionate subject which they are doing. So first thing first, that is Harrison complete. They have to do that. Okay. And any advice for them to do? How about doing these mock exams and all? Definitely mocks. How do you think this mock exams helped you during your course of your the studies, and how they should go in the next pattern?
Sir, the mock exams which I wrote, every week I used to write mock exams, and I used to check where there are mistakes. Actually, 60 questions were there, sir, most of the mock exams, and I used to answer around 45 to 50 were correct. And I used to concentrate on the 10 questions which I went wrong. Whether my preparation is wrong, whether I did not cover the topic, or if is there any memory-based factor which I forgot to read. Then I would concentrate more on the wrong parts, which why I went wrong, and then I used to not repeat that question. And then I used to check my progress every week, and I used to gradually increase. Regarding the next pattern, I think the question should be holistic, sir, clinical-based questions, and the question should cover from each specialty. Like cardiology, you should be perfect with the ECGs and arrhythmias, and in rheumatology also you should be all thorough with the monoclonal antibodies and where to use it. And like that, each super specialty has some concepts. Like I divide the knowledge of each specialty into fact-based and concept-based. This fact-based might not be remembered by everyone, but the concept-based in each specialty is easy to remember if you study once, and you should revise at least one more time. So those concepts should not be made wrong. Fact-based might be difficult for everyone because whole Harrison vast facts in each specialty can't be remembered by all. So the concepts in each specialty are the core, and that will decide your rank. Fact-based also we need to be touched till whatever memory allows.
Okay. So concepts, it's actually retrievable. It's not volatile. It will remain. For facts, you need in-depth reading and repeated reading, and it's better to keep notes of fact-based knowledge you are attaining from the books. Okay. Okay, that's a good tip. But in ESS, I think would be following the same pattern as this time. No? This time.
Yes, sir. Last time when we wrote ESS, 30 questions from the general medicine part and 50 were from the core super specialty part. So in ESS, I don't think there is much need of changing in our preparation. As a preparation for those who have completed MD, they should be on the same path. They should be focusing on general medicine part as well, sir. Because last time when we wrote general medicine, determined a crucial part in the paper. 30 questions were there, and there were many questions which were confusing and which were deciding between two options, and we need to choose one of them. So, and further, general medicine part, Harrison is enough, sir. Core concepts of Harrison in each specialty they have asked, and that should be thorough. And remaining 50 neurology for me, super specialty like me. Uh, I made my notes and I started revising them. And in ESS, I think there is not going to change much thing. But for NEET SS, you should be thorough with the Harrison core concepts in each and every specialty.
I'll ask you a fun question. This time, now, when I saw the recall, I recalled many. I recalled most of the questions, but I couldn't videos. I couldn't make because I was down with Corona. So when I saw these questions, I felt there is. I was doing a study on neurophobia, but I felt a strong neurophilia in these questions, because even in the neurology questions, apart from in the general medicine part, there was lots of neurology questions rather than the general medicine questions. Will this the trend be continued? What do you think? Just it's a fun question I'm asking.
Sir, actually, when I started writing the NEET SS paper, actually, when I completed the first part A, part 40 questions, I was confused whether I wrote neurology or general medicine, because many of the questions were neurology and many are not fact based. They were conceptual. Like they were asking what is the next line of management and what is the next investigation. Like that they were asking, and I was shocked whether I'm writing general medicine part or I'm writing neurology. And when I came into other 60 part B, then also I wrote neurology there. So I think this time the pattern of NEET paper was entirely different from the previous years. Previous years, we have many one-liners. Like if you know, you will crack it. If you don't know, you don't. This time, question was known to everyone, but there was tricky in the question. What is the next line of management? There were options confusing between character extracting and character interacting. So this time they have given a preference for neurology in general medicine part. Even for some other special like endocrinology, they have got more of the questions of neurology in general medicine part. But next part, anyhow, we are going to have a holistic medicine in the next NEET SS pattern. We are going to have a more number of questions. I don't expect whether they will concentrate on which specialty. So we should be thorough with every
but
specialty.
I somehow feel that neurology will be having an upper hand. Maybe I am biased. Okay, let's leave it there. Okay. So I think you have told us how to study, the books to follow. Everything you have correctly summed up. But I want those who are viewing this video to know that all these toppers who are in the top are actually normal people, maybe above average students who have worked and toiled hard. It's not that it's not you cannot reach there. They are hardworking people, and sometimes luck may not favor everyone to get a top rank and all. But hard work you have to follow, as Naresh had rightly pointed out. So Naresh, tell me what would be your final advice to them?
Sir, most of who are doing MD medicine are almost most of them are talented, but talent doesn't work, sir. Hard work is must, and those as you regularly say in your videos, luck favors those who work hard, and most of the time it comes true. But our part should be 100%. We should give 100% in our work and hard work. We should make notes. We should revise, and whether it is in SS or NEET SS, we should try to crack every exam. And one thing is hard work beats talent when talent does not work hard.
Very nice one-liner advice to all of them. I think all will be motivated by all what they have heard from you. All the best to Naresh for his all future ventures in neurology, and thank you for advising all the future aspirants who are viewing this video.
I'm thankful to whole 5 year affiliate team, sir, and thanks a lot, sir.